When it comes to experiences in the healthcare system, it seems everyone has a story and many aren't good.
Tonight, we're learning there's been a significant increase in complaints in Ontario. The details in a patient ombudsman report released today. CTV's Queen's Park Bureau Chief Siobhan Morris joins us live with the details. Siobhan.
Well, the patient ombudsman hopes by talking about some of the problems that Ontarians are experiencing, there can be some level of accountability and maybe some changes. But he is acknowledging that some of the problems he's hearing about are outside of his ability to help. More and more Ontarians seem to be disappointed with their health care. The province's patient ombudsman received almost 4,400 complaints over the last year, a 33% jump.
The big takeaway is the increase in complaints that we've had over the previous years. In fact, it's the most we've ever had.
Roughly half the complaints were about hospitals, followed by long-term care and home and community care. That 37% slice of the pie is complaints outside the ombudsman's jurisdiction, mostly tied to primary care.
Delays in getting care, challenges in getting appointments. People don't have a primary care provider, and so they're looking to get connected to a doctor.
But more than 2 million Ontarians don't have a family doctor.
This is a crisis, and this government is sitting on a massive contingency fund for a rainy day. Well, the rainy day is here right now.
We've got family doctors, nurse practitioners trying as hard as they can, getting driven out of the profession, suffering from burnout, compassion fatigue, moral injury.
That strain shows up in the ombudsman's report in the story of a triage nurse who told a line of waiting patients she'd already worked a 12-hour shift and that hospitals everywhere are understaffed. The patient had had a heart attack and a caretaker drove them 100 kilometers away for surgery.
When you have people who are really so frustrated that they are actually leaving an emergency department, that's tremendously concerning to us because the outcomes are not good.
And can even lead to death. A spokesperson for the Minister of Health says they look forward to going through this report and trying to find ways to improve the patient experience in Ontario.
And Siobhan, I understand the former minister who was in charge during the Greenbelt land removal process spoke with reporters today. What was that like?
It's really interesting. This is the first time we've heard from Steve Clark since August 31st, just a few days before he ultimately resigned over the handling of the Greenbelt file. Now, you'll remember, of course, the government has reversed itself on that policy, the one that caused so much controversy and ultimately cost Clark his spot in cabinet. Despite all that, he says the last few months have been very good. He sidestepped a question about whether or not he feels he's been a scapegoat in all this.
I've apologized for a process that didn't meet the test of Ontarians. It wasn't transparent enough. It was too fast. The government's made their decisions with the Greenbelt bill, and I support the government moving forward. Again, my concentration is on my riding.
Now, since Clark's been gone, the RCMP has launched an investigation into the Greenbelt land removal. Clark says he hasn't been contacted by them at this point to participate in that investigation. Reporting live from Queen's Park, I'm Siobhan Morris. Michelle, back to you.